Hello everyone and welcome to our health education curriculum. In this session, we are going to talk about some diseases like diabetes, obesity, hypertension, and dyslipidemia. And we are going to discuss what we really want to avoid when we're talking about having optimal health. Sometimes we use these words and we hear these words as cholesterol, high blood pressure, glucose, and we don't really know what we are avoiding. So we're going to discuss each of these in this session so that we can know what we are preventing and how we can better take care of our health. To have optimal health and energy, it is important to know certain parameters that tell us which levels in our body are under control and to which we need to pay more attention to. We can take better control of our health by paying attention to these numbers regarding A for A1C, B for blood pressure, C for cholesterol, and S for smoking and stress. We need to take care of cholesterol levels, blood pressure, having a healthy weight, and our blood glucose values. When one or more of these levels are not under control for a consistent amount of time, it can result in our body not working the way it's supposed to. When this happens, our health starts to deteriorate and we can get disease. The next thing we're going to review is the A1C test. A1C test measures the average level of blood sugar over the past 2 or 3 months by measuring the percentage of red blood cells that have sugar-coated hemoglobin. This test is used to diagnose type 2 diabetes, pre-diabetes, and also to see the progression of your diabetes, how well it is being managed. The higher the percentage of A1C, the higher the average blood sugar level. The next thing we're going to review is diabetes. Diabetes is a disease that occurs when your blood sugar is too high. Glucose is your body's main source of energy. Your body can make glucose, but glucose also comes from the food you eat. Insulin is a hormone made by the pancreas, and it helps glucose get into the cells to be used as energy. If you have diabetes, your body doesn't make enough insulin, or insulin is not working properly. Glucose then stays in your blood vessels, and it doesn't reach your cells. When blood sugar levels are elevated for a consistent amount of time, it can start to cause damage to your blood vessels and your organs. Diabetes raises the risk for damage to your eyes, to your kidneys, nerves, and heart. Diabetes is also linked to some types of cancer. Taking steps to prevent or manage diabetes may lower your risk of developing diabetes health problems. What can we do to reduce our blood sugar? We can reduce our blood sugar by reducing the consumption of simple sugars that are found in soda, candy, sugary desserts, and snacks. Also, we have to focus on having a balanced diet, and a balanced diet includes protein, vegetables, and healthy fats. And we focus on limiting the amount of refined carbohydrates. We also recommend getting regular physical activity and taking your medications or insulin as prescribed. We are going to discuss high blood pressure. Blood pressure is the force of blood pushing against the blood vessel walls. It is measured in millimeters of mercury. High blood pressure is also known as hypertension, and it is a condition in which blood pressure remains elevated over time. Hypertension makes the heart work harder, and the high force of blood flow can harm arteries and organs, such as the heart, kidneys, brain, and eyes. How can I manage my blood pressure? If your doctor has put you on medication, take it exactly as prescribed and on the times prescribed. If you're overweight, work to reach and maintain a healthy weight. Be more physically active. We recommend 150 minutes a week, which is equivalent to 30 minutes 5 days a week of physical activity. Reduce your sodium intake and eating a healthy diet, which includes vegetables, healthy fats, and a good source of protein. We are going to discuss lipids. When discussing lipids, we take into account cholesterol and triglycerides. Cholesterol is a waxy substance that is produced and released into the bloodstreams by cells in the liver. The body uses and needs cholesterol to form cell membranes, aid in digestion, convert vitamin D in the skin, and develop hormones. We also get cholesterol from the food we eat. Triglycerides are a different type of fat that is packaged with cholesterol when the lipoproteins form in the liver cells. Triglycerides are stored in fat all over the body and can be an energy source, just like carbohydrates. Total cholesterol is made of two special proteins called high-density lipoproteins and low-density lipoproteins, along with fats called triglycerides. Your cholesterol score is a measurement of these three components of cholesterol. When these levels are not under control, it can result in the buildup of plaques in the walls of our arteries that with time can limit the blood flow to important organs, resulting in heart disease. How can we manage our cholesterol? Get your cholesterol checked at least every 5 years, starting at age 20. Talk to your doctor about your numbers and what they mean, and how they impact your overall risk. Limit your saturated fat intake to less than 5 to 6% of the total calories, and always look with foods that have 0 grams of trans fat. If your doctor has put you on medication, take it exactly as prescribed. Next, we are going to evaluate the lipid profile. When talking about lipid profile, it is important to know that these numbers may vary depending on your age, depending on your health-related issues, so it is important to always ask your primary care physician about how these levels should look for you. In general, these are the values that we consider normal. Remember that HDL, LDL, and triglycerides together make our total cholesterol value. High-density lipoprotein, also known as HDL, are considered the happy cholesterol or the good cholesterol. And this cholesterol can help you get rid of bad cholesterol in your bloodstream. The LDL cholesterol, also known as low-density lipoprotein, another way to remember it is that it's the lazy cholesterol. And that one we want to keep low because it's the one that clogs our arteries and can cause heart disease. In general, our total cholesterol should be below 200. Our HDL cholesterol should be above 40 for men, 50 for women, and our LDL or low-density lipoproteins should be below 100. Triglyceride levels should be below 150. Now we are going to talk about obesity. Obesity is defined by the World Health Organization as abnormal or excessive fat accumulation that presents a risk to health. It is important to understand that obesity is a disease and that it is caused by a variety of factors, including biology, mental health, genetic risk, environment, and healthcare access. Also, intake of ultra-processed food can really have an impact on obesity. Someone with obesity is more likely to have heart disease, diabetes, high blood pressure, and many other health problems. It is important to see obesity as a disease that can cause inflammation in our body. This is why maintaining a healthy weight is essential when trying to live a healthy lifestyle. How can I reach and maintain a healthy weight? To lose weight, it is important to take in fewer calories than you use, so reducing the amount of food you take every day can greatly impact your weight. Also, following an overall heart-healthy diet. Exercising and staying physically active can greatly impact your weight. Now we are going to talk about having a healthy lifestyle or making your lifestyle healthier in any way you can. It is never too late to start living a healthy lifestyle. And to avoid diseases, it is important to eat healthy. Avoid a sedentary lifestyle, be as active as you can, and attend your regular checkups with your primary care physician. Some steps you can take to have a healthy lifestyle are to not smoke cigarettes or use other tobacco products. Have your blood pressure checked regularly. It is important to try to keep your blood pressure below 120 from the systolic value and 80 for the diastolic value. Eating a healthy diet consistent with the recommendations from the American Heart Association and getting 150 minutes of moderate intensity physical activity or 75 minutes of vigorous intensity activity a week. Reach and maintain a healthy weight and have your cholesterol levels checked. Also keeping fasting glucose levels at less than 100 milligrams over deciliter. Something very important when trying to live a healthy lifestyle is knowing where you're at. So having goal setting can really help you achieve what you want in terms of your health and feeling better and living a healthy lifestyle. So we should keep in mind the values that we have. You should always talk to your primary care physician about the values you have and how they should look like. When goal setting, it is important to know where you're at and where you want to be. For example, if my A1C value is above 7, let's say I have 7 or I have 8, a good goal would be trying to lower my A1C value to 6. Another goal we can set is losing weight depending on where I am at, or losing values regarding my cholesterol or blood pressure values. Let's say I have 140 over 90 and I'm going to try to get values that are 120 over 80 by taking my medications and by keeping a record of what my values look like. When setting a goal, it is important to take things into consideration. For example, the first thing is to set realistic goals. If I want to achieve a goal that's going to build a habit and last in the long term, I want to have a realistic goal that I can achieve. For example, if I haven't exercised in 5 years and I want to start having a routine, it would be unrealistic if I say I'm going to exercise 7 days a week, an hour. It's better if I say I'm going to start 3 days a week and maybe 15 minutes. And let's put into a goal something we can actually achieve. Therefore, I can add 10 minutes when I'm 3 months in, and I can be consistent in adding days, like 4 days and 5 days, and I can build habits in the long term. And this is what we are striving for. Also, we want to keep in mind that we want to be really specific. That's number 2. Be specific with your goals. For example, here we have the goal of lowering your blood pressure. Let's say I want to lower my blood pressure, but I often forget to take my medications. I can start by writing it down. What will I do? I'm gonna take my medications as prescribed. How much is exactly as my primary care physician tells me to. And when will I do it? We will do it today, or you set your goal according to your plans. How often will I do it? Every day. And it is very important because when we're doing this, we take into consideration what's blocking us from achieving our goals. For example, I can say, why am I not taking my medication every day? It can be because I forget. That's where we write the challenges that I face. If I forget to take my medication, maybe I can set an alarm, or somebody can remind me too. I can tell my wife to remind me, or my husband, or someone to remind you, and you can achieve these goals in the long term. Thank you so much for being with us in this presentation of health education. If you want to know more information about health education in general, or you want to speak to a health educator, please contact San Ysidro Health's call center and we can give you more information.